Alrighty, welcome to Concussion Chats. My name is Emily, and I will be your host for today's episode. Concussion Chats is a podcast hosted by the McGill students for the Concussion Legacy Foundation with the help of Nick from Concussion Talk Podcast. We are dedicated to providing hope and strength to those suffering from concussions through sharing experiences. But today, we have our first episode of our special edition interview series. During this series of episodes, I will be interviewing several concussion and TBI specialists. Today, our first guest is Dr. Hilary Duncan. She is a clinical psychologist with over 10 years of professional experience, including 8 years at Concordia University, where she completed specialized training in neuropsychological assessment. Her training includes positions at the ADHD Clinic of the Royal Victoria Hospital, the Jewish General Hospital Memory Clinic, and the Johns Hopkins Hospital Neurorehabilitation Unit in Baltimore. She also works in her private practice in the Plateau. Hilary has been involved with several of McGill CLF events over the last few years and one of our biggest supporters, so we thought it would be fitting to have her as our first guest. Hilary, welcome to Concussion Chats.
Thank you so much for having me.
Yeah, thank you. Would you like to tell our listeners a little bit about yourself and what you do exactly? I know I covered some of it.
I would love to. So a lot of what you went through is sort of the training that I had throughout my PhD. All of the hospital names and stuff like that were different internships and practicum experiences. And since then, I've mostly been working in the private sector because unfortunately it is very tough to get jobs in the public sector in Quebec, and also they don't pay so well, but that could be like a whole podcast series on its own. The availability of mental health services within public healthcare. So I've just been working in private practices. I started out working in bigger clinics and then kind of just went out on my own for the freedom. And the fact that I've kind of fallen into being some sort of concussion expert is silly. I find it silly because it's just a default position. There don't seem to be too many people offering therapy, psychotherapy, post-concussion. So since I had this big, long background in neuropsych assessment, and I don't know if we want to go into that later, what the difference is between neuropsychology and psychology, we can. But since I had this background in neuropsychology, and then I started doing therapy, I kind of had both areas covered, the therapy area and then the understanding of the brain and all the things that go on in the brain.
Very cool. Do you want to tell us just a quick bit about the difference between neuropsychology and psychology?
Totally. So clinical psychology is therapy, basically. Like if you are working with a clinical psychologist, you're most likely doing therapy on probably a weekly basis. Neuropsychology is totally different, but they're somehow lumped together in most schools. So neuropsychological assessment is you're sitting down with somebody for 1, maybe 2 sessions, and they are assessing your language abilities, your memory abilities, executive functioning. And then they're writing up a huge report to either give you a diagnosis or to tell you your strengths and weaknesses. So you would see a neuropsychologist if you had a concussion, potentially, if you thought you had ADHD, if you thought you might have dementia, all sorts of different things. If you were basically struggling with any sort of brain functioning, you would get a neuropsych assessment from a neuropsychologist. When you combine the two, then you are seeing somebody who has all that understanding of brain knowledge, but can also help you on a weekly basis with functioning in your everyday life.
Awesome. And you think there's definitely an advantage to that when dealing with concussion?
Based on having seen people who have had concussions for therapy who had been seeing somebody else before me and it didn't work out very well, there does seem to be an advantage. So I've worked with people who had concussions, who wanted to do some therapy, and they would get bad advice from people who have no experience with concussion, or maybe even just kind of hit a wall with their other psychologists because the psychologist might not know some of the cognitive difficulties or how to get around them. If that makes any sense.
Yes, it does make a lot of sense.
Yeah.
We hear a bit about this bad advice
Yeah.
in the support group. It's unfortunate. Do you think you could tell us a bit about how therapy can help with concussions and what issues it can address, at least in your experience?
Absolutely. So it's particularly good for people dealing with like persistent symptoms, right? But it can be useful for dealing with self-doubt. And by self-doubt, where I see that come up the most often is people get stuck in this loop of asking themselves, do I push myself harder or do I take it easy? Am I exaggerating my symptoms and babying myself, or am I risking making things worse? And that like not knowing can be a really tough place to be. There is confusion and frustration dealing with conflicting evidence, like we were just talking about, from friends, family, even conflicting medical professionals. Yep. So a physiotherapist says one thing and an osteotherapist says another, and the doctor that you saw at the walk-in clinic said another thing. Anxiety, obviously, is a huge one, so especially the fear of re-injury. So for some people, this can get to a really tough place where they are actually changing a lot of their behaviors in unhelpful ways that can kind of spiral. Or almost leaning into sort of like obsessive territory and having a lot of intrusive thoughts and fears about re-injury.
Right.
Then, of course, there's depression and adjustment, right? Adjustment to the loss of enjoyed activities, to a stall in your academic plans or your career, to even just the decrease in social activity can be really tough.
Right. Going off a little bit of what you said in the beginning about the uncertainty and doubt, we did have a question that was posed from the group for you that says, do the benefits of returning to your previous level or active lifestyle outweigh the risks? Benefits being reduced depression and anxiety. So I think.
Yeah, that's a tough question.
It is a tough question.
I mean, the easy thing for me to say is it depends on the person and each individual case, but we can dig into it a little bit more than that. From my personal experience, I end up working with people who do hold themselves back more often than I've worked with people who have sort of pushed themselves too quickly.
Okay.
That could just be coincidence. That could be that people who maybe are a bit more anxious seek out therapy more often. So for me, usually the people that I'm working with are not going out anymore. COVID times. So remember that I'm talking about pre-COVID for a lot of this. So people who stopped going to classes, or who previously enjoyed music, loved live music, and felt really anxious and uncomfortable exposing themselves to loud sounds and crowds, and pulled back entirely. And the research shows that that's actually not the best way to approach things, that some sort of graded approach is better. Because the more that you sort of wrap yourself in protective layers, the more you're impacting your mood, but you're also feeding into that anxiety, and it can grow and get worse, so that you stop going to concerts, and then you stop going to friends' houses, and then you stop going to the grocery store, and then you are staying home most of the time. So obviously I can't say in general the benefits outweigh the risks. But from the people that I've worked with, often they're well past those first couple of weeks of rest and recuperation, but they're stuck in that protective rest and recuperation mode.
Yeah, I remember this when I was dealing with my concussion. At the end of the day, I decided soccer was done and I was done playing. But I wanted to at least play like a couple more games or just get out there, kind of get some closure. And I realized at one point I was only getting headaches when I stepped foot on a soccer field. It was like I had gotten so in my head, so much fear was internalized that it was like my brain was hitting panic.
Right. So you're saying like the second that you were there, you were like, I feel symptoms, or yeah.
So it's almost like I needed to return to it a little bit to get out of that headspace and see that, I might be okay, but then.
Yeah. It being Montreal, I've worked with a couple people who either loved cycling or were actual like bicycle messengers for their job. And that was a tough one too. Besides sports, that there was also this issue of like, should I bike again ever? Yeah. Because biking is dangerous. Biking in a big city like Montreal can be especially dangerous. And for each person, it really came down to no one can tell you the exact risk. And it's weighing the risk plus how much value the activity added to your life.
Yeah, I think that's one of the tricky things about recovery is I feel like we just want someone to be like, you can do this, this, and this, and don't do this, this, and this. And your concussed brain is like not getting that. And that's all we want.
If somebody could say like, no, you can no longer play this sport, it'd be a lot easier to just say, okay, I can't play it. But if they're leaving that door open for you, now you're responsible for making a decision based on nothing really. Based on, yes, there is a risk that you could get another concussion, that you could get hurt again. How big of a risk?
Who knows?
Yeah.
It's intense. So I think that you probably can answer this question as well, posed from our group. From your experience, how have you seen concussions interact with previous mental health conditions, including such as anxiety, depression, PTSD? Someone also asked if people can develop or aggravate ADHD post-TBI.
So concussions completely eliminate all previous mental health conditions.
Okay.
No.
What do you... I was like, wait.
Wait a second. No, unfortunately, concussions for some people will kind of reveal things that may have already been there that they had the capacity to function with, ADHD being a big one. Because I also already separately work with ADHD, assessing it in adults who were not assessed as children, who didn't get a diagnosis. So I have some background there as well. And there's definitely a way to tell whether somebody who had a TBI or a concussion, whether they also have ADHD. Some people are afraid that they won't be able to get a diagnosis because they have had a brain injury of some type, but you absolutely can. And you can't really develop ADHD in the sense that it was there before your concussion, but you might have been functioning fine. You might have come up with all sorts of natural compensatory techniques on your own without even realizing it. And then because of the TBI, now you don't have those abilities to make up for the ADHD deficits anymore.
Okay.
And so now it's just like all those things are out there on the table. And you could say the same thing for anxiety, depression, PTSD as well, that it could have been subclinical, right? Everybody has anxiety, everybody has depression to some degree. They don't necessarily have generalized anxiety disorder, which is the diagnosed clinical term, or major depressive disorder. But then it could be that after the concussion, with all the different changes in your life and just with the reduced cognitive abilities, that it kind of ups your symptoms to a diagnosable level.
Yeah.
So yeah.
I want to, maybe you can speak to this a little bit. Something I've noticed is that, I think you were kind of touching on it, is that I think we sometimes separate like the physiological concussion brain damage from like everything else. We're like trying to keep it in its own category, but I found like in my case, I dealt with this concussion, and then in the 2 years after, I had two of my uncles die, and my parents checked out, and I was 14. And I kind of started to develop narcolepsy somewhere in there. So it was like all these external sort of things happening that totally impacted my recovery. Definitely affected how my mental illness comes out. So I don't know if you can touch on, kind of how the actual injury works with
Life.
yeah, life. Like it's not separating those two, I guess. They kind of do go together.
Yeah, absolutely. That's one of the best things about the field of psychology, is that now, in I guess like current modern times, psychologists really try to take what is called a biopsychosocial approach. So you've got biology, psychology, social context, right? Whereas just sort of the medical field doesn't necessarily do that. So like when you first posed this question and you said the biological side of concussion, it made me think of how when you're looking up clinics and resources for concussion, 99.99999% of what you're going to find is physio and vestibular therapy, and right, it's all the very physical stuff, and it's all focused on return to sport or return to school or return to work.
Mm-hmm.
And then there's this, then that's it. They're like, okay, cool. Yeah. So you're fine. We got you functioning again. You can walk, your eyes are good, you're not too dizzy anymore, all of that stuff. Whereas people have lives and things going on in their lives, and that's going to interact with the anxiety or the depression that might be there from the concussion. That's going to interact with the cognitive deficits that are there. So luckily, therapy can step in at that point. And you don't necessarily need a therapist who specializes, quote unquote, in concussion. It's just nice. It's just nice if it's available, right? Because you can be someone who has post-concussion symptoms or even post-concussion syndrome, and you can go see a psychologist to work on anxiety, depression, changes in your life, and that's fine. They will help you with that. It's just also nice if they can be like, oh, okay, what you're describing here is, fatigue due to the concussion. Let's talk a bit about pacing, or, oh, okay, it sounds like you're experiencing some multi-sensory overstimulation. Let's talk about different strategies for lowering that when you're out and about in the world.
Yeah, that makes sense. I'm on the same page. So this person had also asked, with regards to how concussion interacts with previous mental health conditions, how does that affect recovery strategies? And what I'm kind of getting is you take it, as it comes, one thing at a time. But
yeah, and I think it really has to do with each person. So for some people, anxiety is going to be the predominant symptom, and it could be anxiety about re-injury, like I mentioned before. it could be anxiety about, what does this mean for my future? I don't know what to do. What if I can't do school? I was going to go do a master's degree and now I can't. How am I supposed to become a teacher if I can't handle noise and overstimulation? So anxiety can come up for people as like the primary thing going on. Depression might take a similar form in that it's like, I have no future. I feel like there's no point anymore. I can't do any of the things that I used to enjoy. So in terms of recovery strategies, it's really got to be individualized, because everybody's different after a concussion in terms of what their biggest concerns are and how it affected them.
Mm-hmm. Yeah, sounds good. One thing you mentioned earlier, I think we have kind of talked about this at a previous time we chatted, is this post-concussion syndrome debate. Post-concussion syndrome, post-concussion symptom. What is it? Does it? Are we just caught up in semantics? What's going on?
Yeah, I'm sure that some of the people you're going to interview down the line who have more of like a neurobio basis are going to give really good input on this. I tend to just default to saying symptoms.
Okay.
Right, because so the theory is that right now there's a syndrome. There's a defined diagnosable syndrome where your concussion symptoms should have gone away by now, and they haven't. So therefore you have post-concussion syndrome.
Okay.
You'll find tons and tons of research on it. So it is a fairly well-established idea. But since I'm not doing assessments or diagnosing anybody, I don't require a diagnosis. If somebody comes in and says, yeah, I'm 6 months out from my concussion, but I still experience, X, Y, or Z, then okay, cool. That's a post-concussion symptom that you're dealing with.
Mm-hmm.
So I'd rather just break it down to that level rather than require somebody to meet a whole bunch of criteria and have a whole diagnosis.
I like that. So when you have, so we have some people who are, years down the road, right?
Yeah.
And it gets so difficult because I think there are some things about myself that I was like, oh, well, this is just a permanent situation. Like this is from the injury. And then I've ended up in like vision therapy again, 8 years, 9 years down the road, and we're able to fix some of it. But when you have people come in, do you deal with people that are years down the road?
Absolutely. 100%.
Does that change, or are you still just taking it? Are you working on how to get better or just how to deal with the symptom?
So a lot of what therapy post brain injury is about acceptance. So sort of, I can't predict whether you're going to get better. That's what a lot of the medical research is about, right? Is like, if you're at this point and you have these symptoms, what's your prognosis? And they're not good at it yet because it's a really complicated thing. So I can't tell a person whether they're going to get better in any sense. So the idea is like, yeah, that's a possibility. But in order to make any forward movement in your life, we got to work at you being okay with where you are right now, figuring out what matters most to you, what's meaningful in your life, what do you find fulfilling, what's blocking you from pursuing those things. And sometimes what's blocking you is that you're sort of fighting back against all your symptoms, or avoiding them, or being protective of yourself, whatever it may be.
Right. Could you maybe, because this is something that comes up a lot in the group, is this balance between accepting. I think sometimes people hear acceptance and they're like, oh, well, that means I'm giving up.
Yeah.
And I have to live with it. Maybe you could talk a bit about acceptance commitment therapy and like how to deal with that sort of mindset.
Yeah, even the people who, I don't know if invented is the right word, came up with acceptance and commitment therapy have said at various times, like, dang it, I wish we had called it like willingness and commitment therapy. So often you'll see in that literature, in the self-help books and stuff, they'll call it acceptance and commitment therapy, or ACT. And then really, really quickly in the definitions, they'll be like, okay, acceptance is not like, I love it, I want this, I'm happy here. Acceptance is maybe better termed as like willingness. And it's not, I'm willing to just give up and be where I'm at. It's, I'm willing to stop fighting this and start moving in a better direction. Because often we're putting all of our energy into like not facing certain difficult realities, or putting all our energy into avoiding triggering negative thoughts or emotions. And when we're doing all of that and expending all of the energy in those directions, we're not moving forward towards the things we actually care about.
Right. Right. Yeah, it's a fine balance. It's a common topic that gets brought up. So another question, a couple more questions. Are there certain, and this is kind of broad, but are there certain factors that trigger brain fog, and what can be done to prevent brain fog?
Oh boy. So brain fog. First of all, I am in brain frog city, brain fog city right now. So podcast listeners, I am like 3 weeks away from delivering a baby, super pregnant, and that means lots of brain fog. So I've never related to sort of my concussion patients more than I have now, because there's like word finding difficulties and forgetting absolutely everything and stopping mid-sentence and being like, wait, what was I saying here? So the factors that trigger brain fog, I mean, the number one thing is fatigue, tiredness, right? People without concussions, without brain fog, if they are tired, they are going to feel foggy. So if you've already got brain fog due to concussion and you're not getting sleep, that's going to exacerbate it. The other thing would be stress and anxiety. If you're kind of running yourself ragged, or if you are not treating your anxiety through therapy or with the help of somebody else, then that's going to increase brain fog. Related to that, worrying about your brain fog will increase your brain fog, which is always super fun. So this is another one where acceptance is a huge, huge benefit. So learning how to like sort of relax a little bit when you're in a moment to lessen the pressure that you're putting on yourself will help you guide your way through those moments of really heavy brain fog, versus noticing that you're in a moment of brain fog and you're trying to do something and that something is really important, and then you start worrying about the results and about failure and about not being able to complete it. That, of course, is just going to exacerbate the whole situation.
With that, maybe could you touch a little bit on mindfulness and how that helps?
So mindfulness is a big part of acceptance and commitment therapy. And it is one of the most misunderstood like therapy techniques right now, especially because it's often referred to as mindful meditation. And so then people think, okay, cool, this is like a thing I'm supposed to do to relax myself. And I'm supposed to close my eyes and breathe and get to some Zen place and push away all my thoughts, which is the exact opposite of what mindfulness is. Mindfulness is often not relaxing at all. It might end up being relaxing every now and again. That's just by chance. Mindfulness is more like a workout. I find mindfulness really awesome for both concussion and ADHD, because what you're essentially learning to do is learning how to interact better with your brain's natural attentional abilities. I'm going to break that down.
Okay.
So what you are doing in mindfulness is you are picking something super, super boring to focus on. You're breathing. Not really exciting. And as you are focused on the sensation of breath in your nostrils or the rising and falling of your stomach or chest, you're inevitably going to be distracted. Your attention is going to be captured or grabbed by some sort of thought or by a sound outside, and it will wander away to whatever that thought or sound or distraction was. The whole goal of mindfulness is not to get to some sort of space where that never happens, because that's humanly impossible, right? Our brain is designed to be alert to other things at all times. It's not designed to just shut down and have a shield around it. So the goal is not that you will never, ever be distracted again. The goals instead are, number one, that you learn to recognize, oh, hey, my attention's been captured by something else. I've drifted. I'm now thinking about my grocery list. I'm listening to the neighbors argue through the wall. So number one is you notice. Number two is you learn how to notice in a non-judgmental way. For people struggling with post-concussion symptoms or ADHD, when you get distracted, you often get super annoyed with yourself or frustrated, because it's something that happens so often and derails your progress, right? If you're trying to study, if you're trying to have a conversation, whatever. So learning to recognize that you've been distracted, learning how to recognize as non-judgmentally as you can. And then third, how to disengage and bring yourself back. So in the case of mindfulness, you're bringing yourself back to your breathing. You might have to do this 100, 200, 300 times in a 10-minute mindfulness session. The number of times you have to do it is not an indicator of success or failure, right? It's more, how are you feeling? Are you getting better at the non-judgmental part of it? Are you getting quicker to notice when you first lost your attention? And then what happens is when you practice mindfulness, since you're doing it with something super incredibly boring like your breath, the idea is over time, you can start to apply those same techniques of noticing you were distracted. I forgot my steps already. Noticing you were distracted, noticing non-judgmentally, letting go and returning to things like reading a book or studying or a conversation with somebody. So does that make sense? Is that an okay mindfulness summary?
Yeah, I was going to say I've worked on mindfulness for a long time with ADHD, and now it's kind of like I just have this, like during this conversation, I've had a couple moments where I'm like, oh, I'm looking at that blanket, like let me refocus, like, and it just the non-judgmental thing is so important. I find when I'm more tired, more stressed, the judgment comes out, and that's when I really have to sometimes just step away from everything for a few minutes, calm down, come back. And the more frustrated I get, the worse it gets. But it really, like, over time, it's kind of almost the mindfulness. I call it my ADHD timer in my head.
Yeah.
Like it's natural now. Like I don't even think about it. It's like, oh yeah, let's refocus. So yeah, it makes a lot of sense. And I think
I often just start calling it like attention training when I'm doing with concussion and ADHD, because outside of concussion and ADHD, sometimes it's really emotion focused. So it's all about being distracted by an emotion and then bringing yourself back to the present moment, which it's totally applicable there. It's just with concussion and ADHD, I think it can be applied so much more broadly. Yeah,
I agree. I have one question for you as far as the ADHD and post-concussion. So obviously like attention span is something we struggle with after concussion. And this kind of goes back to what we were talking about earlier. Does that get better for people over time, or do they just get better at kind of dealing with their attention, or is it like sort of like the triggering the ADHD, it coming out. You know what I'm
I,
trying to ask here a little
yeah,
bit?
I
Am I
think it's
thinking too
both.
far?
I think
Okay.
it's both, and I think the amount of each category differs per person.
Mhm.
So, I mean, like a lot of stuff with concussion, there is a pretty big improvement over the first 2 weeks, and then you have all
Mhm.
this residual stuff. And how much residual stuff there is crazy. How much it varies per person, right?
Yeah.
Some people have a concussion and they're fine. What? And
Yeah, I
then there are yeah,
know.
wow. Right? There are some people who have a concussion, they have a really rough 1 or 2 weeks, and then they don't really have symptoms following that. But then for other people, they will have lasting effects. There are three things that contribute to the symptoms and our perception of our symptoms, right? One is the actual changes that are going on in the brain. So let's take attention span, for example, right? So let's say there was damage due to the concussion, that now you have a shorter attention span, you're more distractible. Okay. Then there is sort of your anxiety about it. And the more anxious you are about it, the worse your attention span is going to
Mhm.
be. Then there is just your hyper awareness, which I don't think we've even said once yet this podcast, which is a
I
big
don't think
deal
so.
in concussion, right? Hyper focus,
Mhm.
laser focus on that symptom. So it's part of anxiety. But the more you look at something under a microscope, the more faults you're going to find in it. So it's not that you're creating out of thin air or imagining the symptom, but you are absolutely noticing the symptom more, which in a
Mhm.
sense aggravates it. It does make it bigger. And that can be said of brain fog, overstimulation, fatigue, dizziness, nausea. Nausea is a great one for that, where we could both be sitting here, and if we start thinking about dizziness or our stomachs or our heads feeling weird, we can actually start to trigger a feeling of nausea just by
Mhm.
talking and thinking about it.
Yeah. And that's something I think we hear a lot about is I think sometimes our medical professionals try to say what you're saying, just maybe not as eloquently, and it
Yeah.
kind of comes across as minimizing
Yeah.
symptoms. Um, and I think it's a very tricky thing. It's that
Yeah.
balance between acknowledging that you have the symptom and not hyper focusing on it. Uh,
Yeah, I have definitely worked with people who have been completely dismissed by medical
mhm.
professionals and said that, like, there's nothing wrong with you.
Yep. That's,
And my point is, I can't look in your brain. Uh, we don't even have the technology to really explore these things, right? Like MRI doesn't answer these questions. So whether or not your symptom is of like a biological origin versus a psychological origin, to me is, am I allowed to say bullshit? It is a bullshit
go for it.
question,
Yeah.
because if you're having that struggle, you're having that struggle.
Yep.
But I know how when you are the person having that struggle, you want something more concrete.
Yep.
And sometimes that's what we're working on in therapy, is that, like, I'm sorry, there is no way to have something more concrete. There is no definitive measure to say whether your level of fatigue or your level of nausea is organic or not, or is due to the concussion or not, or is just your anxiety. To
Yep.
me, there are ways to deal with it regardless.
Yeah, I think that's something I grappled with for a long time. I wanted to know where it came from, and
Yeah. Yeah.
I needed to know where it came from, and it was finally that acceptance of,
Yeah.
oh well, I'm just kind of anxious and unfocused today,
Yeah.
and that just is how it is today, and we're
Yeah.
gonna deal with that. It's tricky though.
Mm-hmm.
Um, Last couple things. This is also a bit of a broad question. Are there any recovery strategies you recommend that most people are not aware of?
Oh
I know you
gosh.
touched on what mindfulness was,
Yeah.
and breaking down acceptance. And therapy, obviously, is a great option.
Mm-hmm, mm-hmm. So I don't know what most people are aware of.
I know it's difficult when you're in the field.
But I mean, like therapy overall would be the biggest suggestion that I have in case there are people who didn't know that therapy can help with so many things, because often just the more medical physical side is pushed. So I would say like check in with a therapist, whether you know for sure or not that they could help you, is go see a psychologist. If you're stuck on something, right? If there's some problem that you're dealing with that you're stuck on, check with a psychologist. They'll tell you whether they can help with it or not. I have the opposite. I have an answer to the opposite of that question.
Let's hear it.
I think people get caught up in seeking help from as many venues as they can.
Mm-hmm.
And I understand why, but I've seen it lead to lots and lots of money being spent on various physio, occupational therapy, chiropractic, like specialist. And I think that sort of like medical help seeking can be really tough. Hard to find the balance of, is this helping me? Should I be doing this? Or is this me sort of reassuring my anxiety and wanting to feel like I'm doing something?
Right.
And then the fact that you're seeing multiple people and you don't kind of have like a centralized somebody looking after everything can also mean you're getting conflicting opinions. It can mean you're getting straight up wrong opinions too.
Yeah, it can be very overwhelming.
And that's where I think, not to toot your guys' horn for you, but I think checking in with other concussion groups or just other forums, just checking in with people can be useful. And getting opinions from other people, because then you'll have somebody be like, listen, I think you're doing way too much, or that doesn't sound right. Yeah.
And I think it's a little bit of that wanting it to happen faster. Sometimes it's worth it just to seek out one thing and see where it goes. And last question that was posed by the group, and I'm sure you could do a podcast on this question alone. But how do we make neuropsychologists more accessible?
Oh, it sucks so much.
It does.
So the only neuropsychological assessment that I do right now is for ADHD and learning disability. Simply because it actually takes like a long time as a neuropsychologist to do all the testing. Then you do individualized research on that client, and then you write up this huge report. And then you charge what feels like a ridiculous amount of money, but often you're not actually making that much money off of it because it took you so long. But you still feel like crap charging somebody this much, because to them, they just kind of need an answer to a question. And you're telling them, hey, sorry, you got to pay like $2,000 for this within the private system, right?
Right.
But the other option is the public system. And guess how long the wait lists are for adults to get neuropsych assessments in the public healthcare system? Like easily 6 months to a year in some places. Yeah. So it's tough because we definitely need more neuropsychologists, both in private and public. Definitely within the public healthcare system. How do we make it more accessible? I guess it would just be advocacy, right? Is the same way we still need more psychologists available through the public healthcare system. So they have been talking in Quebec. I don't know a lot about it, so don't super quote me on this, but they've been talking about trying to do more mental health coverage through RAMQ with private psychologists.
Very
The way
cool.
that other health clinics are kind of this like half private, half public. So that's
Yeah.
one thing that they're thinking of. And if they did that with neuropsychologists, that would be great too. So RAMQ would cover some certain percent
That
of
would
it
be
at
awesome.
least. Yeah.
Yeah, advocacy.
Mm-hmm. Hard work.
A lot. It is. So I don't have any more questions, but I really, really enjoyed this talk. Did you have anything you wanted to add?
No, this was super fun. I've always been so happy to join your guys' events. Someday down the road, I really want to offer group therapy for concussion. So I'm going to come knocking back on your guys' door to get help with setting that up and figuring out what would be most beneficial to people. So you can just be on high alert for that.
We will be here.
All right.
And I'll
Awesome.
make sure everyone knows. Real quick, I just want to say thanks to Nick from Concussion Talk for helping us do this and put this up on this platform. And thank you again so much to Hilary for your time and for being our very first guest specialist for our interview series. All right, guys, stay tuned for more of these episodes in the new year, and keep checking our social media for an opportunity to submit questions for our future guests. Our upcoming podcast can be found on concussiontalk.com, Spotify, YouTube, and Apple Podcasts. You can find more information about our group on concussionmtl.com. Our peer-to-peer support group is free and open to everyone. We hold 3 weekly meetings on Zoom, which we will link in the description. And thank you so much, Hilary.
Thank
y'all have a
you.
great day.
Bye.
HeadCheck Health bridges gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Trek Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck to improve communication and optimize care. Visit headcheckhealth.com for more. The music at the beginning of this podcast is by Ben Sound. www.bensound.com.